Hi everyone, I'm Dr. Shilpa Kesarity, consultant neurologist at Sai Suhavi Neurocare and Geetham Hospital, Visakhapatnam. Today, I will discuss with you about how to recognize the life-threatening and emergency situations in epilepsy. So as we all know, epilepsy is a condition where seizures tend to recur. They come again and again. In a given individual, if the seizures are occurring at recurrent intervals repeatedly, then the patient is said to have epilepsy. But we need to know a lot about epilepsy because epilepsy is usually stigmatized in the society. As we know about the general knowledge about how to recognize epilepsy, when to go to a doctor, we need to know about the certain life-threatening situations or emergency conditions when we know about epilepsy or when we deal with an epileptic patient, or if at all one of us have epilepsy. So what are these life-threatening conditions? Usually, generally, a seizure duration is less than 2 minutes. But if the seizures tend to occur for a prolonged period, that is, if the seizure is occurring beyond 2 minutes or sometimes 5 minutes or sometimes 10 minutes, then it is definitely life-threatening. Why? Because the more the duration, the more is going to be the hypoxic brain damage. So what is hypoxic brain damage? Whenever a patient is having a seizure, a person is having a seizure, the oxygen supply as well as blood supply may be temporarily cut off to certain areas of the brain. So if the duration is more, we can understand that oxygen supply to that particular areas of the brain is cut off for a prolonged duration. Thereby, the damage can be severe and permanent. So it is of utmost importance for us to know what are these life-threatening emergency situations in an epileptic patient. So how do we recognize them and what to do when we recognize them, when we see someone having that? So when we see someone having a prolonged seizure or any life-threatening situation, so what do? We call for help. Apart from that, we fortunately have certain medications which are already prescribed by the concerned neurologist to abort or stop the particular seizure, which can be delivered even before the patient is taken to the hospital. They can be delivered in the form of injections, sometimes in the form of nasal sprays. So by doing this, we can actually stop the seizure, thereby we can stop the brain damage. So now coming to how to recognize these emergency situations. Number one is duration. So if the patient is having a duration going beyond 5 minutes, or sometimes it can be so severe that it can go beyond 10 minutes or half an hour, or sometimes it can go beyond 24 hours in very, very severe refractory epilepsies. So as already told by me, because the more the duration, the more is going to be the damage. So if the duration is more than 5 minutes, or if the seizures are occurring in clusters. So clusters as in occurring repeatedly with minimal time. So the patient is not able to regain consciousness, and again he's having another seizure. Again he's having another seizure. So these are called clusters of seizures that may occur in a period of minutes or hours or days. So these are also life-threatening emergency situation, and immediate call should be obtained. Apart from that, when we see a patient is having seizure and suddenly the patient tends to have a trauma to the head, the patient can sustain an injury to the head, neck, or any other vital body part. So even that is a life-threatening condition and immediate help should be called for. If the patient is having labor, difficulty in breathing, following a seizure, patient is having difficulty breathing, or if the patient is breathing heavily, breathing more number of times, or breathing less number of times, or following seizure, if the patient is having a lot of grunting noise and the patient is still not able to regain the consciousness. Usually following a seizure, patient may be confused or drowsy for about maybe 10 or 15 minutes. But if it is going beyond that, maybe half an hour, 1 hour, still the patient is drowsy, patient looks as if the patient is in coma, then definitely medical help should be called for. So if the patient, or if one of you have status epilepticus. So what is status epilepticus? That is single seizure crossing 5 minutes duration, or 2 or more than 2 seizures occur within a span of 5 minutes. So this is called status epilepticus. Having status epilepticus or seizures occurring in clusters, or having a head injury during seizure or injury to any other vital organ, difficulty in breathing, prolonged drowsiness. Okay, so these are all the red flags, or these are all the conditions that we should know and we should call for immediate help. And as Any one of you, or do you ever had problems while taking anti-epileptic medications? Usually these things happen when the patient who is on an anti-epileptic drug suddenly stops the medication or suddenly changes the medication. If there is a problem with your anti-epileptic drug, that is, you're having some side effects and you forgot or you didn't want to take the medication, or if you are on multiple anti-epileptic drugs, or if you're having any sleep related problems because of these anti-epileptic medications, or because following epilepsy diagnosis, or because of these drugs you have problems in recalling things, you have memory issues, or you have mood issues, you have a lot of anger, you have a lot of temper issues, you have mood liability. So these are certain comorbid psychiatric conditions. So they can occur with epilepsy, or they can because of epilepsy, or they can be secondary to anti-epileptic drugs, or you have difficulty in falling asleep, or you're having repeated seizures in the sleep. So in certain conditions, what will happen in the daytime, the patient will be absolutely fine. But in the nighttime, the patient tend to have repeated seizures, nocturnal seizures, which we call. So these are all the conditions which you should go and talk to your neurologist and give a detailed history and understand what should be done. And apart from patients who doesn't have this should be known to the family and friends of an epileptic individual. Certain comorbid conditions, like if a patient is having brain stroke or a brain tumor, or if the patient is having a brain infection like tuberculosis or certain other parasitic or viral brain infections, in these particular individuals, the patients can tend to have repeated seizures, or the patients can have status epilepticus, the patient can have clusters of seizures. So if you're having one of these, or if your friends are having one of these, it is of utmost important to know about this, talk to your doctor and get a proper advice. Apart from that, we also should know what should be done whenever there is a person who is having a seizure next to us. That is called the first aid. We should not try to restrain the patient, put the patient in a lateral position so that he won't aspirate whatever contents that are there in the mouth into his lungs. Do not put anything in the mouth. Do not give any kind of liquids. Do not overcrowd. Try to support the head and neck and call for an ambulance or a medical help immediately. So, like as I told in the initial phase of this talk, having a proper awareness is of utmost important. We should be aware and should make others aware as well, so that we can reduce the hospitalizations, we can reduce the morbidity and mortality, that is years of disability or the death because of epilepsy. So stay safe and know about epilepsy, and don't get stigmatized, with the proper education and having a proper follow-up with your neurophysician, being compliant to your medications, taking your medications without any break or without being non-compliant. You can live a normal life. Stay safe. Thank you.